Hello everyone, this is Gaston from the Healthcare Engineering YouTube channel. Welcome back to our another interview session with Engineer Eng.Shamila Ariaratnam. This is her part 3 of the interview session. In this interview session, she is going to talk about what is IEM, Institute of Engineers Malaysia, and another one, Board of Engineers Malaysia, BEM. What are the major functions of these two bodies and what are the processes we need to go through in order to work as a working engineer in Malaysia. After that, she is going to talk about what are the challenges we can face while working in the healthcare industry, and she provides some valuable techniques to overcome such challenges. Please stay tuned with us and subscribe our YouTube channel to get more and more updates like this, and knowledge sharing sessions will be provided in a frequent manner. Kindly subscribe, share, like and comment our videos so that we can bring several sessions like this. Thank you.
Yes.
And in order for any engineer to practice in Malaysia, we have to be registered with the Board of Engineers as a graduate engineer. So if we either study locally or we study abroad, we actually just need to apply for, apply with our certificate, and the certificate has to come from an accredited or recognized degree program by the Engineering Accreditation Council, that's locally. But if it's from other countries, basically the organization that's providing the accreditation to that university has to be a signatory of the Washington Accord. So this is how we register the graduate. So if they are in public universities, nowadays the public universities administration takes the liberty of automatically registering all their graduates with the Board of Engineers in Malaysia. Otherwise, we can actually just do it ourselves. It's actually very simple. It's online. All the information is available online. We just need to compile the document, get it endorsed by a professional engineer, and submit it. Okay, that's for practicing as an engineer. There's also the second aspect to it, which is to become a professional engineer. So in Malaysia now, there is the two-tier system. One is the professional engineer, and the second is the professional engineer with practicing certificate. The difference is the professional engineer with certificate would actually have to submit documents to regulatory bodies in the country. So they have a different assessment, or I would say an additional assessment to actually accredit them as a professional engineer with practicing certificate. So basically everybody goes through a professional assessment competency exam after minimum 3 years serving as a engineer. But there's some experience criteria that we have to fulfill. So we have to have experience in all aspects of engineering before we actually can register as a professional engineer. So besides that, there is also an assessment of the code of conduct. So there's these assessments to actually become a professional engineer. And the registration as a graduate is a compulsory requirement, whereas the professional engineer is actually up to the individual engineer, whether they actually want to pursue it, or maybe it's required by their career. So whatever profession they are in, they are actually required to obtain the professional engineering accreditation before they can actually do their work. So that's what's required in Malaysia. So I've spoken about my first job, second job, third job. Is there any questions you'd like to ask me? Maybe I've left out something.
Yes, ma'am. I think I have around 2 small questions from my side. When you was working as a biomedical engineer in the hospital, So all the medical devices were under some kind of an warranty period, right? Or guarantee period, right? So you purchase from the manufacturers, they provide
Correct.
the warranty. Okay.
Yes, they do.
So
They do.
you, okay. So you can handle or you can troubleshoot the first level troubleshooting whenever the medical devices are under the warranty period, right?
Yes, we can troubleshoot. Yes, you're allowed to
Okay.
troubleshoot, but you
Okay.
can't, because like certain troubleshooting is just checking the error number, verifying against the manual. Okay, with this error, what is the actual cause? So, but we're not
Mhm.
allowed to open the machine and actually undertake the repair ourselves. So that
Okay. Okay.
definitely under warranty, we can't do that.
Okay.
The other
Okay. So
thing
you have
is,
some limitations.
yeah, we have limitations under warranty, and even
Mhm.
post warranty. That means
Mm.
if it's post warranty and if we were to undertake the maintenance in house, right?
Okay.
We
Yeah.
also have to make sure that the repairs are done according to the
Mm.
manufacturer's suggested way of repair and maintenance. Okay,
Mhm.
because we can't just replace a part. It may look like a
Mhm.
normal tube, and then we just use the silicone tube and replace, but actually sometimes it can be detrimental to the equipment. So even
Mm.
post warranty, we have to make sure that when we repair and maintain the equipment is as per the suggested steps by the manufacturer. We
Okay.
cannot just use anything that we think is befitting, because sometimes it can cause to incidences.
Mhm.
So
Okay.
that's warranty. And then sometimes equipment under contract, that means post warranty we put equipment under contract. So those equipment
Mm.
as well, the after sales support team would prefer that we do not how do I say, replace anything, right?
Mhm.
Even if we
Okay.
replace, they would prefer we replace from an existing board of a faulty device, for that example. Yeah. So if I were to take, a mobile device, right? For example, like a
Mhm.
syringe pump or infusion pump, if it was under a contract, that means post warranty, we want the supplier to manage it, right? We need to make sure that it is under strict requirements by the manufacturer, right? So we can't just
Oh,
do a overhaul or a complete modification. Then that may change the intended purpose of the medical device.
mhm. Okay. I understand that. Okay, ma'am. So in your second job, I have a small question. So I guess each and every country has their own standards, right? In their medical devices standards, right?
Actually, when we talk about standards, right, the World Health Organization is actually looking at harmonizing the standards. Why?
Oh, oh,
So that
okay.
a particular equipment sold in country A can also be sold in country B, right?
That's my
So
question
some,
was, yeah.
yeah, so some of these countries have already harmonized their standards. So when they design and manufacture a medical device, it is
Mm,
meeting the requirements of other standards in other countries as well. So that's why they generally
mhm,
use the general consensus standards, which are under ISO or IEC or ASTM, Association for Testing of Materials, International Standards of Organization, International Electrotechnical Commission, right? So these standards are acceptable, uh, you know,
mhm.
uh, in majority of these countries that actually manufacture and produce these medical devices. So even locally, our local manufacturers are encouraged to follow these harmonized consensus standards so that their equipment can also be accepted worldwide.
Okay, okay. That's my question. Okay. Okay, ma'am. Thank you so much for the explanation. Okay, ma'am. So let's move on to the next thing we can talk about. So, as I know, now you play several roles in healthcare sector. How
Mhm.
about the challenges you faced in each and every sectors? Or maybe we can say problems. And how
Okay,
did you overcome such challenges?
right. The first job, which is with the healthcare facility, generally it is very hard to retain employees because the remuneration package is actually, I would say, very low if you were to compare with other engineers in other industries.
Mm-hmm.
So generally, having a healthcare facility is a very cost-intensive business. It's a very
Mm-hmm.
intensive business where expensive to maintain expensive equipment is also expensive. Uh, Parts related to expensive equipment is also expensive. So generally, it is a very cost-intensive, how do I say, business. Running a healthcare facility. Then we
Mm-hmm.
come to the organization itself. You have income generating departments and non-income generating departments. So normally the clinical departments, the departments that actually see patients, are considered to be income generating departments. Then you come
Mm-hmm.
to the support department like biomedical engineering, facilities engineering, um, you know, uh, laundry, housekeeping, car park management, security. So these departments, we don't directly see patients. Hence, we don't directly
Mm-hmm.
generate income. But of course, without our role, yeah, if we don't play a role in the healthcare facility, of course, you can't run the organization as well. So
Mm-hmm.
generally, the the salary package is always, very challenging when it comes to the, I would say, the support departments like biomedical engineering. So if you want to stay in the healthcare facility,
Mm-hmm.
there are a lot of reasons people stay in the healthcare facility. There are things as simple as it's near my house, or it's convenient. I can drop my wife off at work or drop my son off at school and I can come to work, you know. It's some very, very simple reasons people look for. And sometimes
Mm-hmm.
what we hope for is for people to actually turn around and say that I'm happy doing this because I like what I'm doing and I'm passionate about what I'm doing.
Mm-hmm.
So these are the, kind of engineers that will last in the healthcare facilities. It is also very
Okay.
difficult to see a promotion in a healthcare facility because, like I mentioned,
Mm-hmm.
we depends on the on the organization. They have their own reporting system. Some departments they
Mm-hmm.
report to a director. Some departments they report directly to the chief operating officer, right? So if you
Okay.
notice, right, the level, there's just
Mm-hmm.
the technical personnel, the manager, and the next level. So unless the next level and the manager resign or move on or retire, only then, these engineers can move up in the same organization. Otherwise, they will have to look for that promotion elsewhere, right?
Mm-hmm.
But having
Okay.
said that, one of the ways of keeping employees is to actually see what is actually driving them to come to work here. So
Mm-hmm.
not everybody is monetary based. They are actually, people out there who want to actually serve because they like the job, they're passionate about the job, and they stay on with that, right? Besides that, every organization has their own engagement activities. They'll have their annual trips. They'll have free complimentary passes to watch movies. They will have excursions, hiking, yeah. So all these engagement activities also can retain employees in an organization apart from monetary needs. So these are some of the ways that we look at. So generally, with my employees, I go a lot into checking what needs can be met as opposed to what can't be met. So I look at
Okay.
what can be met. So if they want, flexibility, they want more training, they want career pathing. Yeah, we will look at those things. So we can actually improve them in other aspects in terms of technical and non-technical skills. So we can look at those aspects of, making them more well-rounded for the organization. So those are some of the things that I used to look at in when I was in the biomedical engineering department. And then in the conformity assessment role, basically it is something still relatively new in Malaysia. Yeah, it was introduced in 2012. So a lot of establishments, distributors, authorized representatives, they are also unclear on the on the need, on the requirements for the technical documentation. So what we do is we try to ease that process. We try to equip ourselves with as much knowledge as we can, gain as much experience as we can. We try to learn from the medical device authority themselves. We also try to learn from other regulatory agencies. We try to keep ourselves informed and also advise the establishments and ARs and also distributors and what needs to be done. So you could consider it currently in Malaysia, it's a learning curve. I'm sure very soon we will mature, and those would be able to actually contribute a lot more effectively. So those are the challenges that we face in the conformity assessment line. And in lecturing, as I mentioned before, we are in a whole new era where we are sort of like competing with all these gadgets, phones, and the apps that comes with the phones, laptops. So information is abundant out there. So when we actually come up with content, right? So we have to make sure that we really keep our students engaged and interested in listening to us when we are lecturing. And that's if you ask me, is the most challenging for me currently as a lecturer.
Okay. Okay. Ma'am, as you have mentioned that you have faced some kind of challenges in the hospitals. So can you tell me why do we have such kind of we don't have that much vacancies in the hospital biomedical engineering departments, right? So do we have
Yes.
such problems in our countries or all around the globe they face the same problem?
Well, I've
In the
never done a
particularly in
survey,
the hospital side. Okay,
but
okay.
I'm sure someone
Problem in our hospital regions. Even in India, they have the
PhD
same problem.
thesis.
Okay, maybe I can try that one because definitely these
Yeah.
are some major problems we have in the hospital side. Rather than the company
Um,
side, we do have a huge problem in the hospital side, right?
yeah, well, I just look at it this way. In a country, how
Hmm.
many private hospitals do we have? how many public hospitals do we have, right?
Mm-hmm.
And then the next is, where else can a biomedical engineer go? So how many manufacturing facilities do we have, right?
Okay, I
And then,
understand that now.
okay, if they go to the next part, if they are, going to join an authorized representative or they're going to join a distributor, just how many of these establishments are there? And both you and I know that most of these organizations work on a very lean workforce, right?
Mm-hmm.
So they will try to multitask. That means they will try to get one person to do